All right, let's get started. Good day to everyone. The Global Nutrition Cluster is happy to welcome you to the webinar on nutrition vulnerability analysis for decision-making in low access areas. This webinar will be recorded so that we can share the recording afterwards, and the recording is already in process. We do have simultaneous interpretation available for you today. We appreciate 𝗏𝗏𝗃𝗃 providing Arabic interpretation and 𝗃𝗴𝗹𝗁𝗃 providing French, both with the 𝘃𝗵𝗃 agency. Please click on the globe icon at the bottom of your screen to access the interpretation. You may need to click on the 3 dots to locate the globe icon. While our colleagues join, please take a moment to introduce yourself in the chat with your name, organization, and where you're listening in from. We are thankful for the support of our GNC donors, without whom we would not be able to deliver this webinar. We are also thankful for all of the active participants of the GNC working groups who work so hard in the nutrition and emergency space. I'll now hand over to Anu Narayan, the Senior Advisor for Nutrition with UNICEF, to take us forward and get the webinar started. Over to you, Anu.
Thank you, Miriam. Good morning, good afternoon, and good evening, colleagues. My name is Anu Narayan. I'm Senior Advisor at UNICEF, and I'm really excited to welcome you to this very important webinar. For all of you who are joining here today, you know that the humanitarian sector is grappling with 2 famines, increasing number of families and communities who are facing hunger, a deepening of child wasting in multiple countries, particularly those which are affected by conflict, displacement, and significant constraints to humanitarian access. Add on top of that funding cuts and significant institutional changes, whether it's at the UN or international or national NGOs, I think there's never been a more important time for us to come together as a community and identify solutions to these challenges. And that is what we are hoping to do today in our dialogue through this webinar. The first really is, I want to focus attention on the need for sort of alternate approaches that we need to take. In the past, we've been lucky to have traditional surveys that have always been able to answer important questions about the status of acute malnutrition, in particular in humanitarian settings. And in fragile and conflict-affected settings, we have seen that access constraints and insecurity and operational challenges have made this increasingly difficult. And sometimes that has resulted in data either being outdated, incomplete, or completely absent altogether. And these funding cuts that I was referring to before have only made the situation even worse. And this is why I think we have come together today to talk about flexible, resource-efficient methods that can generate what we are calling good enough data, data that we can stand behind and be reliant on, but is also able to tell you a story that is relevant for the changes that are happening on the ground at a time. I wanted to spend a minute to talk about the importance of nutrition data and how more than ever before, it is incumbent on us as a community to come together to make sure data is actually available in a timely manner. Because we have seen the powerful narratives that nutrition data has always been able to tell, but ever more than now, the reliance on malnutrition data to be able to do multiple things, advocate for humanitarian access, make sure policy changes are put in place, put pressure on member states to make sure that they are able to act stronger, faster, and better so that humanitarian access can be determined. And in this time where we absolutely must protect the use and availability of nutrition data, I also want to sort of emphasize the importance of collaboration. This work that we have done has come together between UNICEF and WFP, using all our resources to bring to bear in coming up with the nutrition vulnerability analysis here. But I also think we wanted to speak to and refer and call out the very important work that has happened with a number of national, local partners, as well as international partners whose technical expertise has been so important for us to bring this work to you. And I I really want to emphasize that the vulnerability analysis, which will be presented in detail, speaks to both qualitative and quantitative data, and really builds on local capacities and knowledge for us to be able to tell our story. And finally, a word on the importance of having data like this that can drive from knowledge to action. And the shift, or the paradigm shift that we are talking about, is that we're just not talking about diagnosing or indicating the prevalence of acute malnutrition or other forms of malnutrition. But we really want to use this analysis to sort of speak to the drivers of and the underlying causes of malnutrition, so that our actions can not only do the treatment that we are able to do, but also drive to addressing some of the risks that families, communities, mothers and children are facing in terms of acute malnutrition in their communities. And for that, I think we call for clear and strong governance, where there is leadership and predictive financing and funding. There's improved analysis so that we can understand and explain who is vulnerable, why, and how are shifts happening, and then better be able to communicate that in many ways. So it is really a call for a shift of mindset, with collaboration really at the key, for adaptive analysis, for using data with sort of ability in which that we can do what it's meant to do, really, to ensure that humanitarian services and life-saving services and humanitarian action can remain front and center for all the work that we do. So with that, let me pass it over to Anne-Céline, who will introduce to you the speakers, the objectives, and be able to walk you through this exciting webinar. Over to you, Anne-Céline.
Many thanks, Anu, for setting the stage and reminding us why exploring alternative approaches like the NVA is more important than ever. So now moving to the objective of this webinar, you can see that there are 4. The first one is really about presenting the nutrition vulnerability analysis as an innovative approach for context where traditional surveys cannot be conducted. The second one is about highlighting the use of remote and qualitative methods and the engagement of local partners who know best the context. The third one is to demonstrate how the nutrition vulnerability analysis can consolidate fragmented information into a structured consensus-driven analysis. And the last one is to illustrate through practical example how the NVA provides actionable evidence to monitor risks, anticipate deterioration, and enable timely life-saving decisions, especially in constrained settings. Slide, please. So you will see that the session will be organized around 4 main points. The first one really about the introduction, providing you some kind of background information on the why and some specific notion that we applied within the nutrition vulnerability analysis. Then we will go through a presentation on the methodological approach, the process, presentation as well from 2 country offices, namely the SOP from Gaza and the Myanmar team, and then having the conclusion before moving forward with a Q&A and the closing remarks. Slide again, you can go to the next one. So before handing over to my colleague Gwenaëlle Garnier, so you will see that the nutrition vulnerability analysis is really about generating evidence in fragile and settings for decision making. This has been a long journey on which UNICEF, WFP, and a lot of other partners, namely the CDC, Tufts University, Impact, the French Red Cross, ACF, the IPC, the GNC, put a lot of efforts over the past few years to make sure that even in complex humanitarian and complex humanitarian settings, we can come with a narrative that really ensure that we provide the information related to the nutrition situation. So we know that for now, and Anuradha already mentioned that, but insecurity, access constraints is some kinds of limitation that we are observing. In any case, we should be stuck in providing the nutrient narrative behind the situation. So the nutrient vulnerability analysis is really coming to fill this gap. It is a structured and consensus-based approach that provides actionable insight on the nutrient vulnerability, even without recent anthropometric data or limited anthropometric data. And for that, we are analyzing the driver of nutrition insecurity. Please, slide, and I will leave the floor to my colleagues, Gwenaëlle Garnier.
Thank you, Anne-Céline. Good morning, good afternoon, good evening to all, and welcome to this webinar. So the nutrition vulnerability analysis help us move beyond just measuring outcome like malnutrition rate. It digs into the why. Guided by the UNICEF conceptual framework, we look at 3 pillars: immediate, underlying, enabling, and mitigating factors. This enables us to build a fuller, holistic picture of risk and vulnerability. This approach also helps strengthen the narrative when outcome data is mainly available through screenings and rapid methods. By connecting all these layers, the NVA produces credible, good enough evidence to inform programming and advocacy, even where traditional data collection is constrained. Next slide, please. Applying the good enough approach in fragile and conflict settings, it's our new norms, I would say. In humanitarian setting, waiting for perfect data often means missing the window to act. The NVA has been designed to work within those constraints. It prioritizes timely, credible insight using the best available evidence. It's not about lowering standards, but about maintaining analytical rigor even when data is incomplete. That means transparent methods, triangulating sources, and clearly documenting assumptions, so we can still make informed decisions when it matters most. Next slide, please. Why nutrition vulnerability analysis matter? And I think Anu set the scene, but in fragile and conflict-affected setting, we often face serious access challenges that make traditional nutrition assessment impossible. The NVA offers a practical solution. It helps us build a credible narrative of the nutrition situation using whatever data is available. Its real strength lies in being consensus-driven, bringing together quantitative data, qualitative insights, and cross-sectoral evidence through coordinated analysis. This fosters shared ownership and collective responsibility, ensuring that decisions are grounded in a collective and credible understanding. Next slide, and over to you, Anne-Céline. Thank you.
Thank you, Gwen. Thank you for this introduction, for reminding us again why the NVA matters right now. Exploring alternative approach is really important. Slide, please. So let me now walk you through the methodological foundation of the NVA. So as you can see on the screen, the slide here presents the overall methodological approach of the nutrient vulnerability analysis. As Gwen just mentioned, the nutrient vulnerability analysis is anchored in the UNICEF conceptual framework on the determinants of maternal and child nutrition, which recognizes that nutrition outcomes are shaped by multiple and interlinked drivers. The NVA applies this lens in crisis settings where anthropometric data are limited and gold standard surveys are not feasible. The NVA looks across the food dimension, the health environment, the service access, the care practices, and the aggravating and mitigating factor. All of these elements are then brought together in a structural validation where multi-sectoral stakeholders review the evidence collectively and agree on the level of risks and its impact on the nutrient situation. By doing so, the NVA ensures that analysis does not rely only on isolated indicators, but instead provides a holistic picture of the risks and vulnerabilities affecting nutrition in fragile and conflict-affected contexts. Building on this framework, the NVA is organized around a clear structure process, which we will see on the next slide. Slide, please. So you will see that the NVA follows a clear 8-step process that moves in a logical sequence. It begins with defining objectives and scope, then mapping and compiling existing data and leveraging routine data wherever possible. It also integrates additional evidence through both qualitative and/or quantitative means before moving into collective interpretation and analysis. The process then continues with validation alongside partners and finally sharing the results and reflecting on the lessons learned. Each of the NVA has been designed with access constraints context in mind so that even when data is limited, the analysis remains both credible and actionable. Altogether, those 8 steps, which represent a structured process, helps to turn fragmented information into a coherent picture, one that can guide timely and well-informed decision. So now let's look at the first step in this process. Slide, please. So this is the first step of the NVA. The first step of the NVA is about defining the objective, the scope, and engaging the stakeholders. So together, these different elements set the foundation for a successful process. It starts with establishing a small, trusted core team, bringing together technical, operational, and advocacy expertise to guide the process. Before launching the NVA, this core team should also conduct a light, rapid data landscape review to see what information is already available or existing and to clarify as well the assumption about feasibility. Once that is done, the next action is about defining the purpose of the NVA and as well its geographical scope. Here, it's important to prioritize areas where NVA findings can add the most value. A clear terms of reference should then be developed and agreed among the core team, setting out the scope, the rules, the responsibility, and the timeline quite clearly. On the other hand, but equally important, is the stakeholder engagement to form the analytical team. This analytical team will be the one supporting the analytical process. So from the very start, sectoral, local actors, as much as possible, should be involved, not just as data provider, but as essential partners. Their participation helps to build ownership, align expectation, and ensure that the analysis remains actually relevant and meaningful. In conflict-affected settings, this engagement obviously must be handled with particular care in order to protect neutrality, safeguard technical integrity, and build trust in both the process and the results of the NVA. So as you understood, step 1 ensures clarity, inclusivity, and ownership, all of which critical for the credibility of the analysis. Slide, please. Building on the preliminary data landscape review conducted in step 1 by the core team, the step 2 is really about ensuring that the NVA builds on what already exists, avoiding duplication and identifying gaps. It also sets the stage for any new data collection strategies, if needed, making them targeted, feasible, and grounded in context. Step 2 is about systematically bringing together all relevant existing information. This includes data across key domains such as food security, health, WASH, displacement, social protection, as well as operational data set and insight from partners working on the ground. The main purpose is really to highlight where the gaps are, so we know what might require targeted collection later on. To do this effectively, our recommendation is to organize the data using the UNICEF conceptual framework, which will help identify gaps clearly and enables proper multi-sectoral analysis and triangulation of all the stream of information. It is also essential to apply quality check during the compilation of the data, asking ourselves which organization collected the data, where and how, and identifying as well any potential biases. This obviously ensures reliability, but this is quite foundational and will guide how the information will later be used in terms of triangulation and analysis. And last but not least, and because we are talking about context where humanitarian access is often restricted, it's really critical to establish as well, when we are talking about data, clear and ethical data sharing protocols. Secure systems should allow access and collaboration while protecting sensitive information. Rules for uploading, reviewing, and citing data must be clearly defined to ensure ownership and accountability remain transparent. So altogether, step 2 lays the groundwork for a transparent and credible analysis. I will now hand over to my colleague Malaika, who will take you through the next steps, which is about strengthening evidence base by integrating targeting nutrition-sensitive questions and making better use of routine data. Thanks.
Thanks, Anne-Céline. So continuing on with the process, we now go on to the steps really about looking at what data we need to collect. So the step 3 is about making the most of existing opportunities and systems to gather nutrition-sensitive quantitative information. We would have identified mostly with the data mapping that Anne-Céline has mentioned where the gaps would lie. The idea is to work with other sector leads, such as food security, social protection, health, and others, to identify where nutrition-sensitive questions can be added to ongoing assessments. So we're not starting from scratch. The idea is not to duplicate and have parallel systems. While we always would like to have a large range of data, the idea is to leverage on our data mapping and the gaps that have been identified, and then prioritize indicators that we can collect. Ghazza will be giving a demonstration of how this was done and how there was a leveraging of nutrition-sensitive questions that were inserted into food security surveys. Importantly, we need to adapt these questions to be clear and culturally appropriate, especially if we're using remote data collection. And again, Ghazza will highlight the thought process that was put into this as the questions were included. But we don't stop there. We also leverage routine data, such as HMIS, MOAC screenings, or many other monitoring systems. This is to fill the gaps and triangulate the findings. There is a lot of data in routine systems, even if they might have some shortcomings at times. As highlighted by Gwen in her introduction, good enough data, triangulated, can be used to understand the context. Moving on to step 4, next slide. This is still about data collection, but this is really focusing on qualitative data collection. We don't always have the opportunities to collect quantitative data. So the idea of the NVA is to look beyond quantitative approaches and leverage also on qualitative approaches. This will be demonstrated by the Myanmar example later on. Qualitative data can either be complementary to either triangulate and help understand the why and the how of how certain drivers might impact nutrition, providing a much richer data narrative and understanding, or it can be even used as a standalone, as the main primary evidence stream, as the Myanmar case will demonstrate. Either way, it's important to contextualize the data collection. Engaging stakeholders from the start ensures that the data that is collected is credible and contextually relevant. We use purposive selection to identify key informants with local knowledge, ensuring diverse perspectives. This is incredibly important when we're looking at qualitative data. The lived experiences are as important as the institutional findings that can be provided. When possible, we bring national consultants on board to strengthen trust and access but also to provide a much more grounded guide to the qualitative data collection. We design the interview tools that are tailored to the context, concise when they're supporting other data, so when we're just trying to understand and fill the gaps a little bit with a more qualitative approach, and more comprehensive when it is the main source, as will be demonstrated in Myanmar. As always, ethical standards such as informed consent, confidentiality, and voluntary participation are important throughout this process. Qualitative data is as important as quantitative and has to be done through an ethical way. Next step. This, as 𝗀𝗀𝗃 highlighted, is where we start centralizing all the data we have collected, all the data we have compiled. As 𝗀𝗀𝗃 highlighted, we work with the analytical matrix, and we sort of have this analytical matrix drawing from the analytical framework. This step is really about turning the data into sort of insights, bringing all the data together to understand what all the different data and triangulation is telling us. We first prepare the matrix by compiling the baseline data, the recent findings from either quantitative or qualitative, and the metadata that we have also collected on who has collected it, where it's collected, how it's been collected. This sets the foundation for the discussions. Then we bring stakeholders together in an inclusive session to interpret the data collaboratively. Ideally, this would be a mix of those who have collected the data as well as the different expertise that are involved. We apply then a structured scoring method to assess both the reliability of the evidence and the severity of concern. This will be highlighted by both the Gaza and the Myanmar in how this was done. Finally, we build consensus around the findings, ensure that every classification is backed by a clear rationale. When there's disagreements, we also include why there's disagreements, and we note all the different debates that are happening. This approach strengthens transparency, which is vital to the NVA. It strengthens credibility and a shared ownership of the results. Next slide. Once we have finished the plenary sessions, we go into the validating the report and the sharing of the results. We focus on ensuring the findings are accurate, credible, and useful. Firstly, with the technical validation and stakeholder review. So we bring everyone together again, we discuss the findings, we discuss the rationale for the classifications, and we confirm that we all agree with the findings. It's important that we just don't produce a report. We actively share the results in ways that support decision-making, program, and advocacy. And we make sure that the findings are integrated into the existing processes like the IPC, humanitarian response planning, that had been identified in step 1 as highlighted by 𝗀𝗀𝗃. Next slide. Importantly, the NVA is not a static process to us. It's meant to stimulate reflection and thinking outside the box for what is good enough. What is good enough to drive decision-making? Therefore, the final step is about learning and improving, reflecting on what worked, what didn't, and why, questioning our mental models, so that we can strengthen future applications. The idea is to center local perspectives, ensuring that those closest to the context shape the learning and shape the NVA. It's also important to document any innovation or adaptation that have emerged during the process that can continue improving the NVA. We're now going to be hearing from 2 experiences where the NVA has been rolled out, where we'll hear the different methodological approaches that were used for each, one a little bit more quantitative, one a little bit more qualitative, as well as the lessons learned and the reflections by the teams. Over to you, Nakai, for the first example.
Thank you so much, Malaika, for that background information. I would just like to say hello to everyone, and thank you for everyone for allowing us to share our experience using the nutrition vulnerability analysis in the context of the Gaza Strip. My part of the presentation will focus on Gaza's nutrition vulnerability analysis, its innovative methods, and how it shaped the humanitarian response in Gaza. Next slide, please. Here I'll provide a brief background on the Gaza crisis. So before October 2023, Gaza in the state of Palestine had among the lowest acute malnutrition rates in the region, only 0.8% global acute malnutrition rate. Then stunting was around 9%, and some micronutrient deficiencies, of course, existed. Therefore, child malnutrition was relatively stable. This context is actually important to understand how sharply the conflict changed the situation. So the conflict started in October 2023, and it caused immediate disruption, with displacing over 1.7 million people within weeks of the conflict starting. This also disrupted the different basic service delivery systems, and there was a collapse of the food, wash, and health systems. So other impacts that were observed included movement restrictions, which limited access to goods and services by the population and also limited the humanitarian response. Next slide, please. So with the evolving situation, it was important to understand the nutrition situation in the Gaza population to be able to fully quantify the needs, where the needs were, and identify the most at-risk populations. However, a proper anthropometric survey was impossible due to the constant displacements that were happening and other operational challenges. The nutrition cluster had to find other innovative ways to be able to define the nutrition situation. So looking at the timeline of events that we had, the conflict, like I mentioned before, started on the 7th of October. Then by the 12th of October, the humanitarian community led by OCHA had put together a flash appeal, which was a document highlighting all the needs and also the financial requirements that we needed. And we identified that 7,300 children under 5 were in need of malnutrition treatment at that time. Then the nutrition cluster in the country was established by 7 November 2023, which is a month after the conflict had started. And by February 2024, we had our first nutrition vulnerability analysis document being published. Concurrently, we had the flash appeal being extended, and the vulnerability analysis was an important tool that was used to inform the growing needs in the flash appeal extension of January to February 2024. Then the flash appeal that was then another flash appeal that was produced in April 2024 noted that 52,000 children were in need of malnutrition treatment, which was a 700% increase in children estimated to need treatment. And this was also informed by the vulnerability analysis. So I will go into the vulnerability analysis methodology just to see how we got to these numbers and how the situation evolved. Next slide, please. So if we look at the nutrition vulnerability analysis, it used a multi-sectoral approach that looked at the key drivers of acute malnutrition, which included access to services, food security, wash, health, and social protection. So there were different variables that were selected for the analysis and for the continuous follow-up, and these were divided as shown on the table on the screen. The first variables were the impact on nutrition through the health system. And through this, we looked at acute respiratory infections, diarrhea, and changes in infant feeding practices. So the second set of variables were impact on nutrition through the food security, where variables like food consumption at household level, dietary diversity for children, and pregnant breastfeeding women were considered. Other indicators that were monitored included nutrient-dense products, access, coverage of nutrient-dense products, general food assistance coverage, nutrition services coverage, and non-trauma-related deaths in children. Then we also had additional MOAC assessment data that was then considered in addition to these drivers, triangulating with all the drivers. Next slide, please. So there were three main data streams, and I think like what Malaika has mentioned before, these data streams were already available, and we looked at how we could integrate nutrition variables into these data streams. So first, I'm going to talk about the SMS-based surveys that were done by UNICEF for their post-distribution monitoring for the CASH program. So these were targeting CASH recipients and would also collect dietary diversity information. And we would receive data on both pregnant breastfeeding women and children from this data stream. Another data stream was the routine MOAC screening data, where we would get data on MOAC from health centers, shelters, and communities. The Global Smart Initiative supported the data cleaning, processing, and analysis, making it possible to use estimated prevalences to be able to inform the nutrition situation in Gaza. We also had remote household surveys, which were conducted by WFP through the 𝗃𝗏. And for this part, I'll give my colleague Ali to give more information on the 𝗃𝗏 and how we collected information through this. Over to you, Ali.
Thank you, Nakai. Hi, everyone. I'm 𝗃𝗶𝗃𝗀𝗏 from Palestine WFP country office. I'm pleased to be part of this webinar today. First of all, this 𝗃𝗏 survey, we launched this survey after 7th of October conflict. Ongoing until this moment in Palestine, in Gaza Strip specifically. We launched this at the end of November 2023 to feed into the IPC. From the beginning, we worked closely with the nutrition team, WFP, UNICEF, and other nutrition experts to shape and refine the nutrition module. The design was revised multiple and the module revised multiple times to make sure if it fully captured the needs and aligned with our goals. Next, please. Of course, the survey was focused on food security indicators, and related to the nutrition indicators, we focused demographic, morbidity, and the diversity. First of all, we focus on nuclear family. Nuclear family, that means father, mother, sons and daughter, not include the extended or hosted family that live in the same house. This approach important to ensure we capture consistent and comparable household level data. So we focused, for example, if the sample from the sample we contacted with household, we focused just on the clear family. If other household live in the same house, we exclude and we didn't reach. Just focus on the nuclear family. The other question, number of children under 5 years in the household. Now, not focus, for example, if any of the children die, just on the number of children and under 5 years in the household. Now, all nutrition related question in this survey specifically directed at this group. The reason is that the children under 5 are the most vulnerable to malnutrition and health complications when food insecurity arises. We reduced the risk of overestimating household need due to extended family member, as I mentioned, is still capturing the most at-risk population segment. We mean the children under 5. The results for younger children also provided important early warning signal about broader household food security trends. This is the objective of included these two questions. The other question, as you see, how many meals did your household consume yesterday? The number of meals consumed by the household yesterday, we used the standard reference of 3 meals. This is breakfast, lunch, dinner. This question gives us a clear indication whether family members are eating regularly and whether they are able to meet even the most basic daily nutritional needs. It's specifically critical for vulnerable groups like pregnant women and lactating mothers, where reduced meal frequency or irregular consumption can have serious health implication both for mother and the child. So this measure is not only about quantity, but also about the quality and consistency of food access, which help us understand if they apply any coping strategies like, as you know, reduce coping strategies, reduce number of meals, reduce the quantity and the quality of the food. Also, we included a morbidity question. This is asking if any children under 5 years suffered from illness in the past 2 weeks. Look at the most diseases spread also reported by WHO. As you see, high temperature, diarrhea, respiratory infection, skin infection, vomiting. By the way, we added vomiting and HbA recently. After maybe until this moment, we did 6 rounds of IPC. We added this after the second. And our updates, we will ask about this is if any, but now we want to update this survey next month. We will ask about each children under 5, each family member under 5 in the household. Next, please. These two questions focus on the dietary diversity and the infants feeding. First of all, we use this for 2 rounds, for the infants feeding, if there is any change in how they feed the child in the last month. But we removed this question for 2 reasons. The first reason, because we received a few cases, few number of the household that they have infants. The other reason, because the mother or the infants rely specifically on breastfeeding. So by over the period, we noted that little or no variation reported in this indicator. So we removed it from our survey and focused on the children 6 months to 23 months age. First of all, we ask if the family has any child from 6 to 23 months. And when we ask them, just ask them about one child. This question includes 9 food groups. We focused on the, when we estimate the indicator, we focused on the, from second one to 8. The first one, this is because distributed from food assistance. So we want to monitor if this household received this kind of food or not. From breast milk, legumes, fruits and vegetables, eggs, grain, dairy products, meat. This is what we included when we estimate the data diversity. This score from the highest score 8 and the lowest score, yeah, by the way, 0. Next, please. No, I think there is a chart. Yeah, this is the chart. The dietary diversity score represented by this chart. This is what we need from this question. This gives us indication about if the dietary diversity for the children in the household deteriorate, improve or no. We see that the highest score in February 2025, it's approximately 2.5. And this means that number of the household that has children under 5. And you know that there is deterioration until July 2025. The peak in February 2025 refers to the entry of commercial and the humanitarian trucks and the ceasefire period, while the deterioration after the blockade and the increased escalation, yeah, you know that the improvement start from July, yeah, in August, slight improvement. Yeah, this trend gives us strong indication of how external factors like market access, humanitarian aid entry, this directly shape dietary diversity among children in affected households. Yeah, thank you. I want to hand over to Nakai. Thank you.
Thank you so much, Ali, for giving the details on the 𝗂𝗏 collection of the data through the 𝗂𝗏 surveys. Just to note that combining these different data streams that we have mentioned created the good enough evidence base in the absence of traditional surveys. Also to note that we also triangulated with information coming from other drivers, for example, health data from the HMIS, WASH data, social protection, and any data that could really inform the nutrition vulnerability analysis was included. Can you just go back to the previous slide a bit? Yes, so not this one, the one that is in the middle. Yeah. So the Nutrition Information System Technical Working Group, which brought together different experts on nutrition information in the country and also at global level, was essential in this nutrition vulnerability analysis process, where partners reviewed all the data points and assigned reliability and severity classifications. So a consensus had to be reached on the different reliability scores, and this built technical consensus and allowed joint decision-making. This process really strengthened transparency in the analysis. Can we move on to the next slide on the results? Yes, so this is an example of severity classification results that we did for 2 nutrition vulnerability analysis, one in February 2024 and another in March 2024, comparing them to the baseline results. So you would find that for each determinant or each variable, we had to classify it as low, moderate, severe, critical, or extremely critical, depending on the consensus. Where there was insufficient evidence or an insufficient sample, then we just would not be able to get the severity score. So at the end of the day, if you look at the March 2024 results, we ended up combining some of our governorates or provinces, if some would call them, to be able to have enough evidence to rate each determinant. Next slide, please. Just to give an example of the key findings, in another nutrition vulnerability analysis that was conducted in May 2024, it shows that acute malnutrition rates in that analysis were still low, but the risk of rapid deterioration remained high. The other drivers of acute malnutrition had completely deteriorated. For example, you can see that it shows 93% of children were consuming less than 2 food groups. And also other vulnerable groups like children under 6 months, older children, and the elderly were flagged as being often overlooked. And like I mentioned before, by April 2024, the 𝗂𝗶𝗶𝗃 had estimated that the children in need of treatment were around now 52,000. Next slide, please. Okay, so in total, we were able to work on publish three nutrition vulnerability analysis reports on the Gaza Strip. And by September 2024, we had now started carrying out the 𝗊𝗶𝗃 acute malnutrition analysis in a way which then replaced the vulnerability analysis. But the evidence from the different vulnerability analysis that we did from the start of the conflict until June 2024 really shaped our response. It shaped the flash appeals. It also shaped 𝗊𝗶𝗃 classification, because these vulnerability analysis was feeding into the 𝗊𝗶𝗃 classification for food security before we had the 𝗊𝗶𝗃 acute malnutrition. And also it helped partners in terms of targeting for nutrition response. Then also the nutrition vulnerability analysis also provided us with a shared evidence base. So it really avoided fragmented narratives and allowed us to have one voice as the nutrition community working in the Gaza Strip. And just to also note, it influenced coordination priorities on geographic focus and also on the interventions. Next slide, please. Finally, to say that we built systems from our crisis. So the nutrition vulnerability analysis experience shifted technical leadership from global to local actors, which strengthened sustainable capacity. Also, a monitoring framework was developed for real-time monitoring of the nutrition situation in an active emergency. And from our end, we are really glad to have benefited from the nutrition vulnerability analysis and to share the Gaza model as a global example of how to conduct nutrition assessments in extreme operational constraints. Thank you so much, and back to you, colleagues.
Thank you very much, Nakai. So now we'll go over to the Myanmar example.
Thank you, Marika. Good morning, good afternoon, good evening, everyone. So I'll be presenting about our experiences in conducting Myanmar nutrition vulnerability analysis on behalf of the country and VA team. Next slide, please. So Myanmar is actually experiencing a chronic and compounding crisis where there is widespread conflicts, as well as conflicts that are happening off and on, natural disasters, the economic collapse, and mass displacement. So these have led to a breakdown in the essential services, where the vulnerabilities within the country have intensified, and there is a rapidly growing humanitarian needs, which increased from 1 million in 2020 to 19.9 million in 2025. So among this, the 3 million require nutrition support, where 1.9 million are children under 5, as well as pregnant and breastfeeding women. Because of this chronic and compounding crisis, the country is facing access and operational challenges, such as shifting territorial control, movement restriction, and persistent insecurity. Next slide, please. So this severely constrained situation, as well as insecurity, displacement, and bureaucratic bottlenecks have made standard surveys and traditional data collection inside the country to almost impossible. And with the rising nutrition risk as well as humanitarian needs, especially for among children and breastfeeding women, pregnant and breastfeeding women, evidence is really urgently needed to guide these life-saving actions. That was the reason why NVA was conducted within the country, and it really offer a practical alternative approach to bring about essential insights and to guide program planning and actions within the country. And next slide, please. So during the beginning of the process, the core team, we set together to identify and prioritize areas and select the township where we will potentially conduct these NVA exercises. So we based this selection on highest historical prevalences of malnutrition within the country. We also looked at the IPC EFI scoring, the recent ones, and also consider the conflict situation, which was really unstable off and on. And in addition to these information, we also looked at the availability of data and partners in these specific areas, and we make sure that there is at least 3 sectors representing these areas to ensure there is multi-sectorial overview. So based on this exercise, we selected 4 townships from 2 states and regions, which were later in round 1, which was later expanded to 10 townships across 4 states and regions in round 2. So during this process, we also developed a data sharing protocol, which will be used during our bilateral advocacy meetings. So because of the sensitive nature of the country and because of this sensitivity, we had to conduct bilateral advocacy meetings with interested partners as well as actors on the ground level. So during these bilateral advocacy meetings, we explain to them about what is NVA, what we are trying to achieve, and we walk them through this data protection protocol. And once we have their interest, the partners' interest, as well as their agreement, we began conducting these bilateral trainings to the partners as well as those who will be conducting these key informant interviews on the ground. So for as described earlier, the Myanmar NVA is purely focused on qualitative data, which is used as primary evidence base. Next slide, please. So we conducted key informant interviews was the main thing that was conducted within the country. And this key informant interview was actually led by a national consultant. So this national consultant was on board really early in the process since the development of the data sharing protocol as well as specific questionnaires. And this national consultant was also involved in translating these questionnaires so that they are context specific and also culturally sensitive to the population that we will be asking these questions. So led by this national consultant, there were trainings and the interviews were conducted by CSO partners together with frontline actors and as well as community leaders. So as described in earlier slide, we conducted 2 rounds of NVA. First, 2 states and regions across 4 townships, and then we later expanded to 4 states and regions, including 10 townships. So the first round 1 was conducted in March 2025, and we followed the round 2 in August 2025. So at each township, we conducted a total of 5 to 15 KII interviews. So the KII interviews were stopped once we have a period called data situation where we could not conduct, where no new information came out from these interviews. That's when we stopped the interview as in these specific township. So because of the sensitivity of the situation and nature of the security, in some areas with high security risk, we had to be more creative, where we coded these qualitative NVA questionnaires together with the frontline actors. So what we did was we go through each questions together with these frontline actors who will be collecting the information, and then what we did was we highlighted the sensitive questions and we coded them so that the risk becomes as minimum as possible. In addition to the KII interviews, we also collected sectorial thematic assessment from multi-sectorial needs assessment, food security analysis, and other relevant sources that we could obtain. Programmatic and field observations were also provided by international and local partners that are working across nutrition, food security, health, WASH sectors throughout the country. Next slide, please. So once we've finished collecting this KII interviews, the consultant led the translation of these results as well as cleaning, and then we put them into the NBA analytical framework. And once these has been completed, we conducted a series of plenary sessions. So the plenary sessions were conducted in local language to ensure there is participation and active discussion among the analysts. And during these plenary sessions, we conducted separate session for separate township, and at the same time, we anonymized all the stakeholders that were involved in these plenary sessions. So the stakeholders bring contextual and operational expertise onto the table, and it was because we anonymized it and we also conducted in local language. It was a very active discussion. So we also use a concern scoring approach to classify the severity of nutrition-related vulnerabilities. And each of the score is really based on convergence of the qualitative findings from the KI interviews, reported or observed impacts on the security, as well as the assessment of stress levels, the coping strategies that were detected through these interactions. So the NVA within Myanmar is really focused on interpretation, discussion, and expert judgment, and not on numeric information. Next slide, please. So this is the result of the round 2 NVA analysis in the country. So in this concerns summary table, you will see that in majority of the township, the situation is very, very alarming in the country, where concerns are from high to even critical. Because of the nature of the country situation and how everything is changing really fast. In certain areas, even within the township, we had to separate different scenarios when we are assigning different concern levels. So for example, in Township 4, under livelihood strategies, you will see that in that particular township, for local people who are residing in those areas, the situation is moderate. However, for IDPs that are entering to these areas from other conflict-affected places, and also female-headed households, and as well as people with disabilities, you will see that the concern is very high. So it's not just that particular area. We had to make similar adjustment and similar separate analysis in different sections as well. Next slide, please. So the NBA in Myanmar was conducted under significant operational access constraints. So it does have its limitation that we need to consider when these findings are interpreted. So the first one is data gaps. Because of the access and logistical barriers, we could not conduct any anthropometric data. And these areas that we conducted NBO was highly conflicted areas. So it was very hard to conduct the anthropometric data collection. The findings are really based on perception and qualitative inputs from KII, as well as partners, validation, and secondary sources. The coverage was also another constraint that we had to consider. So even in the same geographic location, the population coverage is limited to certain areas. So in areas where our interviewers, the enumerators could not reach, even in the same township. So in very, very remote locations, they could not go there. So in these situations, the information were not collected from these remote locations, even within the same township. And then these NVA were collected at a township level, so it will not represent state and regional level. And there may also be underrepresentation of displaced and marginalized populations, such as IDPs and returnees, although we try to include them in certain, because of the nature and context, there's a lot of displacement and a lot of movement. So it's likely that it will be underrepresented in these findings. Another one is, which I have been saying a lot, is the rapidly evolving context. So the ongoing conflicts sometimes is very off and on. So it might not be happening now, but tomorrow it might be happening. So it was very unpredictable in these areas. There's also market disruption and then the displacement really very quickly. So even in the areas that were selected, in certain areas we had the displacement was chronic. It was a bit longer, but in some areas the displacement was like 3 days and minimum, and then they go back to their respective location once the local conflict has settled down. So it was always a rapidly evolving context. In addition, for the August analysis, the March 2025 earthquake, although is becoming more distant, it still had its indirect effects on the food system, as well as service, access, and the humanitarian operations that were conducted on the ground. Then another limitation that we faced was the very tight timeline and the availability of stakeholders for this plenary session. That was basically because we had to complete this NVA exercise in time for the IPC-AMN within the country. Our timeline becomes very tight. So initially during the plenary sessions for the round 2, we planned that we'll have one session with separate rooms, which will be conducted in both languages, so English and Burmese. And that we could not do that because of the very tight time frame. And later in the end, we focused on having this as a local language. And also we wanted to make sure that there is representation of the on-ground actors as well as the CSO, and then the people who are actually on the ground and experiencing the situation. So that was the reason why, because of the tight time frame, we just did one local sessions. So, yep. Next slide, please. So we learned a lot from doing this NVA exercise, where we learned that a structured qualitative approach really works in assess constraint crises, such as Myanmar, where we cannot conduct these standard surveys. By doing this NVA exercise, it really provided a structured qualitative approach and really provide insights of the ground situation. So it proved a credible, timely, and actionable information that really fill the gaps that are urgently needed within the country. We also learned that the local actors are essential analysts and not just informants. So by including the frontline workers as well as the community in these plenary sessions, they provided a deep context-specific insights across these nutrition drivers. So the KI interviews identify areas and situations that's happening on the ground. That when we have these plenary sections where local actors from multiple sectors are included, we were able to dig much deeper with the information that we collected from the KII, and it really reflected the reality of how the situation is and how the system have collapsed and how the vulnerabilities are happening on the ground level. The next part is the validation and triangulation really build the credibility, because we included multi-stakeholders in the plenary section. So it was not just technical expert, but it was also CSO, the people that were working on the ground, as well as on-ground local experts, and as well as the community. Some of the communities were also involved in the plenary sessions, and because we anonymized it, they feel more free to discuss and be open about the actual situation in the ground. So that was a very good and really eye-opening exercise. And then the pathway-based framing really supports multi-sectorial action, because the findings from this NVA were structured around food, service, and care pathways. So it really clarified specific entry points for different sectors to use and enable in their integrated planning and prioritization action. And the most important one was the timely and strategic communication was very, very essential to make sure that this NVA exercise is completed, and delivering of timely insight is really, really important. So good enough data, as my colleagues have said, is very, very useful. And when they are used in an appropriate way, it really brings about a strong narrative of what's actually happening on the ground level. Next slide, please. So in addition to this, we also found that by conducting this qualitative NVA exercise, it provides a more deeper information that can enhance program planning, because the contextual information and experiences, the local realities, as well as the unspoken challenges, emerging sensitive issues were really highlighted and brought up. And having these plenary sessions really helped us to dig deeper of the situation, which a quantitative approach cannot identify. So it was very, very great exercise. And then it's the information that we gather also will provide support in designing responsive activities. So from the NVA exercise, we also got more information about how things are shared, information are shared, foods and everything is shared within this population in the context. Next slide, please. Yeah, so as described briefly in the previous sections, the NVA in Myanmar was also used to integrate into the IPC-EMN. And for data constrained contexts like Myanmar, by integrating NVA to the IPC-EMN, it contributed a much needed qualitative evidence, because by having this NVA, it enables analysts to have a deeper understanding of the situation where information is limited, where the data is weak, and where context-specific information is really, really needed to come to a consensus of specific basis. So the NVA also provided a new dimension to the IPC analysis within the country. Another point that I want to highlight, that for IPC-EMN in Myanmar, it was not conducted at a CSO level, but NVA was highly conducted on a CSO level, bringing in together active the frontline actors. So by integrating these two methodologies, it really balances the representation and strengthens both approaches and both findings. So this is the end of my presentation. Thank you so much for bearing with me. So over to you, Hassan. Thank you.
Thank you very much, colleague from Myanmar. Colleagues, as we come to the close of today's webinar, I just wanted to highlight a few key takeaways. Next slide, please. So first, the NVA, or the Nutrition Vulnerability Analysis, as we've seen, is grounded in clear principles. The principle of inclusivity, making sure that it's part and parcel of the systems and the structures that exist in the country, including all the key stakeholders, national, international, UN, government, and others as much as possible. It also is anchored around ethical practices, so making sure that we do no harm, we prioritize the dignity, safety, and having informed consent of all the key participants in this process, and the data is handled using that principle. But most importantly, it's also anchored on the principle of operational usefulness. So these principles have guided its application in some of the most constrained contexts, as you've seen in Gaza, in Myanmar, in Sudan, and has ensured that even without perfect data, the analysis remains credible and actionable. Next slide, please. Second, the NVA is not a replacement for our existing tools, but rather it's a complementary approach that fills critical evidence gaps. It allows us to connect the dots across sectors, so nutrition, food security, health, WASH, social protection, and others, ensuring that decisions are informed even when traditional surveys are not feasible. Next slide, please. And third, we are already looking ahead. So guidance is being finalized to adapt the NVA process for areas with limited access as part of the IPC protocols, including neo-inference techniques like nowcasting. This will further strengthen its integration into the IPC analysis and broader humanitarian frameworks. As the colleague from Myanmar has mentioned, this has already been applied both in Gaza and in Myanmar. And just something to note that the IPC acute malnutrition analysis in Myanmar was in fact the first ever to be done. And that was made possible mainly, not primarily, but mainly by the fact that there was evidence coming from the NVA, the 2 NVAs that were conducted there. But most importantly, today's discussion has shown that this approach is only as strong as the partnerships behind it. And this is very important to highlight. The NVA is built on collaboration, bringing together UN agencies, academia, NGOs, international and national, governments, and local actors who hold the contextual knowledge to make the analysis meaningful. This is really important to highlight because part of what we're trying to do is make sure that the quantitative evidence is accompanied by very clear, localized, contextual knowledge and information that really explains some of the trends and the data that we see. And that is only possible through the very strong collaboration that that has been demonstrated in the way the NVA has been designed and in where it has been applied. So as a next step, we do encourage you to access the tools when they will be shared. They would be accessible through the cluster website, and to also consider how the NVA can be applied in your operational context. We believe that together we have a collective responsibility to ensure that children and vulnerable populations do not remain invisible because of data gaps. On behalf of UNICEF, World Food Programme, and the Global Nutrition Cluster, and all the partners that have been involved, we thank you for your active participation and leadership. The NVA represents a paradigm shift in nutrition analysis, and your engagement is key to making sure it delivers life-saving impact when it is needed most. Now we will move over to the questions and answers session, and I'll hand over back to Anseline.
Yeah, thank you, Hassan. So we hope that all the presentations that have been made by ourselves and the different colleagues from the country teams has been relevant to you and helpful to understand the NVA approach. And as Hassan was mentioning, now this is time for Q&A. So I already see some different questions in the Q&A space. So I don't know if you want me to go through. So what?
Start answering them, Anseline. The first two are on 𝗂𝗊. So there's a couple of questions on the 𝗂𝗊 survey, and unfortunately our colleague had to leave to go home. So I'm going to be answering on behalf of the WFP 𝗂𝗊 on the WFP Gaza office. So there's one question about, in retrospect, about whether we should have kept the under 6 month question in, which we did take out, because there has been many issues regarding small children's nutritional status. It is a very valid point. I do think still the sample size was incredibly small. We are now exploring more qualitative approaches, and I think from the lessons that we've learned from Myanmar, looking at the qualitative approaches and how we can leverage that as well to understand things like the issue regarding small children's nutritional status, some of these sort of gaps we still have in Gaza to really complement the nutrition information system that we already have built. Following on from that, there's also a question about the morbidity for the 𝗂𝗊 survey. We are looking at children 6 to 59 months. That is how the question is framed. So it's looking at children 6 to 59 months for the morbidity. What we did learn, as Ali had mentioned, was we initially sort of grouped all the children in the households, but that didn't give us a lot of disaggregated analysis. So now we're asking per child in the household. Over to you, Anseline, maybe to answer the last question about the time needed.
Yeah, thank you, Malaika. One other question was related before the one on the timeline was related to the guidance and the training materials. So everything will be finalized by early next week and accessible through different channels, especially the UNICEF Knowledge Hub, the WFP library, as well as the 𝗃𝗵𝗶𝘀 website. Regarding the timeline for conducting NVA, and based on our experience in Gaza, Sudan, and Myanmar, we would say that the average duration is between 4 to 6 to 8 weeks, really depending, I would say, on the complexity of the context and the stakeholder engagement. Looking back to the experience that we had in Gaza, for instance, the first round of the NVA was set up in 5 weeks. And then, the second round and the third one was much faster because obviously, all the process was already known by the different partners. The integration of the question into the 𝗃𝗴𝗃𝗃 were already set up, and the qualitative approach or the way we will use the qualitative lens was also already discussed. So for the second round and the third one, I would say that it took us about 2 weeks to 3 weeks to come with the analytical process and arrive with the findings. In Myanmar, for instance, it was a bit different. It took us a bit more time because all the sensitivity of the context and the fact that we really need to be careful about all the qualitative information, the coding that Chen-Mei already mentioned during her presentation, and all that. So the average, I would say, between 4 to 8 weeks maximum, and depending on the regularity on which you are conducting it, it can be. And there was as well another question related to cost for one round. To be honest, the NVA is not really costly. This is more about bringing all the information and the partner together. So I would say this is more about time consumption and dedication to the process. In Myanmar, we hired a national consultant to conduct the key informant interview. So the expenses or the cost was really, really low. But no other cost was associated to the nutrient vulnerability analysis, since we are really working with all the data that are already existing from routine multi-sectoral assessment and key informant interview where this is possible. So no huge associated cost depending on the stream that you are using. I don't know if there is insight maybe from WFP in terms of integration of additional question into the WFP 𝗃𝗵𝗃𝗃, for instance, if this is something that has been costed per se.
No, we haven't costed that part because it didn't add much time into the 𝗃𝗃𝗃 survey. As you saw, we only added the minimal amount of questions in, not only from the cost perspective and the time perspective, but from the time of that respondents had to be answering. So we kept the costs minimal because we were using existing platforms.
Yeah, thank you. Is there? I will invite your colleague to ask question in the chat if there is any that you feel that should be responded. Yeah, I see one hands up from Mustafa Aden. If you would like to come in.
Yes. Can you hear me?
Yeah, we can hear you.
Yeah, first of all, thank you so much. Thank you so much for the comprehensive presentation on the nutrition vulnerability analysis approach. This is really, it seems to me very impressive. First of all, this is Mustafa from UNICEF supporting the nutrition cluster, the national nutrition cluster. I was just wondering, because I was curious to understand the trend for the MBD for Gaza, where it has been deteriorating all along from when the data, from the period that the analysis started with to all the way to July, and there is also upward trend from August. So I just wondering what has improved in that month in terms of the MBD. It is just curious to understand how the situation is evolving. But my real question here is in Somalia, we are equally data constrained. Somalia is also classified as data constrained context in which data is extremely difficult to generate from all the country because of security and insecurity and conflict. And as a result, the IPC analysis focuses on only districts that are accessible, and also other districts which are hard to access. But first of all, the analysis is livelihood by livelihood zone. But for the districts which are hard to be accessed, the IPC analysis uses extrapolation approach, where we extrapolate data from the neighboring districts with the same geographical and population characteristics, and infer the whatever result is we get from that district to this district. So I'm wondering, going forward, would you say that the NV methodology would give us, I mean, a superior insight into analyzing the inaccessible areas, given that even historical data is very limited? That's my question. Thank you so much. Otherwise, the presentation was very impressive and understandable. Thank you.
Thank you, Dafa. Maybe we will leave this question to Hassan. Hassan, if you want to come in.
Yeah, thanks. Thanks, Mustafa, for that question. Just a very quick response is, yes, the idea is exactly for the NVA to be applied in a context like the one you've described in Somalia, where normal traditional type of data is difficult to come by, and the intention here is that the approach would facilitate a mechanism that would exploit the different types of information that exist, but also highlight what sort of gaps in data that may need to be collected to form that clear picture of what is actually happening in that context for children, with a much better clarity, sort of a more holistic clarity of quantitative and qualitative nutrition outcome and vulnerabilities, to better then form a picture of what is actually going on there with children, but also inform processes like the IPC. So rather than extrapolate, as you say, you may have a lot more sort of credible evidence that would meet the minimum requirements for inclusion in an IPC analysis.
Okay, thank you, Hassan. So maybe, and because time is flying, I will leave the floor to Miriam from the GNC to conclude the overall session. And thank you again for your participation. As already mentioned, all the materials will be available by next week, and we hope that it will be really for all of you in terms of looking at how we can transform the situation analysis by using different alternative approach. Thank you.
Thank you, Anne-Céline, and my deepest appreciation to the team that has worked so hard to develop the NVA process and present the tool to us today. The recording will be made available on the GNC website, and you will receive an email in about 1 week with the link. If you do need support for nutrition in emergencies, please do reach out. If you'd like support from the GNC, don't hesitate to make a request on the website. Multiple languages are available on the website and from the team. Once we close this webinar, a survey should pop up on your screen. We would greatly appreciate you taking 2 minutes to provide us some feedback so we can continue to provide webinars that are helpful for you. Thank you and have a good rest of the day.